Hello, I'm Dr. Winston T. Cope, MD. I'm an ophthalmologist specializing in cataract surgery. I received my eye surgery training at Duke University, and I've been in practice in Pinellas County since 1979. I offer my patients the most accurate, no-stitch, no-needle technique with special emphasis on gentleness. If you have cataracts, please come see me. Hello, I'm Dr. Winston T. Cope, MD. I'm an ophthalmologist specializing in cataract surgery. I received my eye surgery training at Duke University, and I've been in practice in Pinellas County since 1979. I offer my patients the most accurate, no-stitch, no-needle technique with special emphasis on gentleness. If you have cataracts, please come see me.
Today we are going to speak to Dr. Cope, who is an eye specialist, and he's going to tell us about cataracts and eye diseases.
My parents were the first ophthalmologists in the area. I went to college, the university at Oberlin College in Ohio. And then I came back here to Florida, to the University of Florida for medical school. Then I had my medical internship at the University of Miami. And then I served in the United States Navy for several years, and then went on to Duke University, where I studied my ophthalmology and eye surgery, and I've been here since then. Even when I started in 1979, the surgery involved a lot of stitches. It was very difficult for the patients. You almost had to stay in the hospital for several days, whereas now, of course, it's a rather quick outpatient operation, which we'll talk about. So there have been many, many improvements in safety and comfort for the patient too.
And instrumentation, the technology goes on, right?
Yes, the instrumentation is the main thing that's made this possible. As surgeons, we're no better surgeons than, say, 50 or 60 years ago. Our hands are the same, but the instruments have made it possible to make the surgery so much better. Cataracts don't hurt in any way. The cataract is a cloudiness in the lens of the eye, inside the eye, behind the pupil. And so there is no pain. What patients notice is slow increasing fuzziness over time. And many times it sneaks up on you. And most people complain about driving at night or seeing street signs. And some people find they now have to use a magnifier to see small print. It's slow, and really what sometimes forces the situation is that people will lose their driver's license. And then all they have to do is have a cataract operation and they can get it back again. So driving is probably the main thing that causes people to have cataract surgery, because they don't want to give up driving. And why should they? The day of the surgery, the vision's usually fuzzy. The second day, the very next day, and the day after, the vision usually clears up quite quickly, and people are pretty happy. Most of my patients come because they've been referred by other people that I've operated on. They come because they know someone who had the surgery, and they say, well, Mrs. Jones had her operation and you did it, so I want to be like her. So all your questions need to be answered, and that's important.
I hope you enjoyed our program and learned something about your eyes and cataract surgery.